right, good afternoon. We'll go ahead and get started. Feel free to use the chat. We're going to go over a few slides, and then if either one of you have a question, towards the end, maybe chime in. And then also, before I get started, I'll let you know that you'll get a copy of these slides and then a few extra pieces of info once we're all done. I'll actually send it to your email address. So thank you so much for joining me on a Saturday. We're going to do an overview of functional medicine. I changed the format of how I made contact with potential patients a little bit ago because I noticed that many of us had the same questions, had the same concerns, and it just figured, well, it's a lot easier for us to cover it all together. But then also with this format, I can send you a little bit of extra info, which, like I said, you'll get copies of the slides and a few other pieces of info when we're all done by your email address. So if you found me, odds are you probably did a search for functional medicine. You were looking for someone, maybe with a holistic approach. So it's good to start off with a definition of what is functional medicine. And it's basically the holistic approach addressing the root cause of disease and focusing on a personalized treatment plan. And we'll get into that a little bit more in depth in a few more slides. But we use tools differently in traditional medicine, allopathic medicine, or clinic-based medicine, hospital-based medicine. Your tools tend to be somewhat limited. But when we're doing the functional medicine approach, our tools are nutrition, lifestyle changes, cutting-edge diagnostics, coaching, support. And what that means is we get a really enhanced way to help you get to where you want to be with your health. So when we're taking the functional medicine approach, the diagnosis helps, but we really got to go beyond just what the diagnosis is. So this slide comes from the Institutes of Functional Medicine, and this is where I've completed my training. I know that for your sense, it looks like a bunch of bubbles, doesn't make a lot of sense. But what I like to point out on here is that our traditional approach, which is organ system diagnosis, which I practice internal medicine. I've been doing that for 20 years. In traditional medicine, we focus on the endocrine system. Is there a problem with the glands, the digestive system, the brain, or the nervous system, neurology? So we do take all that account with the functional medicine approach, and then we counter that with looking at the biological functioning. So we look at how these various forms and functions of the body are working together and where an imbalance could be keeping us from feeling our best. So this side-by-side comparison is, and again, because I know a lot of people had not heard of functional medicine, didn't quite understand it. So I put them side by side, and both are great. I've practiced both. I've practiced conventional medicine for many, many years. The functional medicine approach is newer to me, but really the two should be hand in hand. Where we are in current practice in the United States, we don't have them quite hand in hand yet, but I don't think we're going to be too far away from that. In conventional medicine, it's disease-centered, whereas in functional medicine, we focus on the patient. So in conventional medicine, what that means is if you have a diagnosis, essentially your chart will be built around that, and recommendations will be more of a systemic recommendation that would be population driven. Whereas in functional medicine, your symptoms and where you are, what's going on with you is the approach. The diagnosis is still important, but it's not everything. In functional medicine, we try to get to the root cause. We try to figure out what may have caused the imbalance. Whereas in conventional medicine, we do have to focus on the diagnosis because it is driven by reimbursement, by insurance, and we have to turn over certain information to them. So that tends to change the treatment plan to more of a diagnostic approach. In functional medicine, we collaborate. It's a partnership. So They are my patients that are in my practice. However, I try to get them to think of themselves more as the captain of their ship, and I am their advisor, navigator. I can provide what they need and the information they need, but my patients ultimately decide what's going to work for them. Whereas in conventional medicine, it's standardized, very much disease driven, and there's an authoritative, so that unfortunately, when the patient doesn't agree with the doctor, it doesn't always go well, which is really kind of sad because 99% of the time the patient's actually right. Also, the physician's right. You just need to find a happy medium, but those kind of disagreements can lead to care being very disrupted. In functional medicine, we have laboratory diagnostics that have scientific evidence that really can advance care that can be tailored specifically to your needs, whereas in conventional medicine, we tend to do standard lab panels. Everyone gets the same exact labs. In functional medicine, we look at lifestyle. So when my patients and I are working together, we start to figure out what's going to work for them, as far as their sleep, what they're eating, how they're living, where they're working, how they're working. It's a big question, but that's where we approach it. Whereas in conventional medicine, as I mentioned earlier, our two tools, or well, we don't have that many tools, but our tools tend to lean on pharmaceuticals. When you need those, they're very important. But a lot of times in conventional medicine, you start with a prescription and you never end with a prescription, and you don't ask those important questions as far as what else could happen beyond the prescription. We see food as medicine in functional medicine, and it is an integral part of what you'll be doing, making sure that your body's getting what you need. What happens more often really is that I'm encouraging my patients to eat more. Most people have a fear that they'll be heavily restricted on what they're allowed to eat. And that's actually not what happens. A lot of times they actually need to consume more variety, more volume, more nutrients. And that actually can make it kind of fun because it means that you have to sort of play around in your kitchen or play around with how you acquire your food. And it's not necessarily any failure if anyone doesn't, because when we're dealing with how we eat, how we live, our kitchens, that's one of the hardest places um, to fix. Whereas in conventional medicine, we really don't have a space for that. Now, depending on what's going on in your diagnosis, you may have to work with a nutritionist, and you may have very specific dietary needs. That's a little bit different. But the vast majority of patients won't likely have a one-on-one consult with a nutritionist because insurance typically won't pay for that for all patients. And then finally, in functional medicine, our goal is actually to restore your health. So when you start the journey, one of the things you think about is a time in your life you felt really good. And that's what we try to get back to. Whereas in conventional medicine, we don't see it that way. It's more of controlling or alleviating the symptoms, which is absolutely necessary. We have to, keep those illnesses at bay. They don't get too severe or dangerous, but we don't ever really get to the ultimate fix. So a few slides back, I had mentioned that biology approach. I said, we focus more on your biology and what these imbalances are. So on my side of it, as the physician and collaborator and the partner in your care, is to understand or try to understand and help you understand your body's biology. One of the things we look at in functional medicine is what's called assimilation. That translates to your digestion, your gut health, and how your gut health influences your hormones, your nervous system, how your gut health influences your skin, your joints. But in the functional medicine approach, we look at the health of the gut. Do you have the types of bacteria that are good for you, that help you have a happy gut? Do you have the right types of bacteria that produce the chemicals that help your body feel better? Are you carrying certain bacteria parasites that may be draining your system? So that's the assimilation approach, but you hear more commonly is gut health. We also look at what it's to me is your defense and repair system, but to the patient, what's that translate as is your immune system. We have a look at how your body can protect itself from the environment. Can your body heal from assaults? If you have to have a surgery, is your body optimized? Or if we happen to start working together and you're about to go into a big surgery, what can we do to make you sort of super normal, better than normal, so that you can recover from your surgery even faster? So, but for the patient side, what that translates to is your immune system. Is your immune system overactive, where it might be attacking your joints and muscles? Is it underactive, where you're getting sick too often? We talk about a concept in functional medicine called the communication system in your body's biology, ability to communicate with itself. What that translates to is hormone balance. So every person's unique and optimized hormone balance is different from everyone else. We have general guidelines for what we think they ought to be for most people, but it really depends on where your body is. For some of us, we need certain hormones to be very elevated because of, maybe we're trying to have a baby. For other of us, we might need those same hormones as low as possible because we may have been diagnosed with something like breast cancer or prostate cancer. So we might need a little of those hormones, but we want them to be lowered out and balanced. We also look at something, well, on my end of it, it's the integrity of your system, but for the patient's end of it, it's how the musculoskeletal system works and operates. Your bones and your muscles are a huge reservoir of nutrients, calories, energy, big calorie burners. Your bones do more than just move your body. They protect your body, and they also store important elements that you need, and they can release those at times. So in the functional medicine approach, we can have a look at those and make sure they're where we need them to be, that you're not draining your system, that your muscles work when you want them to work, so that if you're wanting to increase your activity, do more, take a big trip, get ready for something, that you're in better position to do that. We look at something that's called in functional medicine transport. What that translates to on the patient side of it is how your body moves things in and out. So how do things get inside of you? How does it come out of you? And how do things move around? Does your heart get blood to all the parts of your body? Does your lymphatic system drain the waste appropriately? And then even part of that is your digestive system. Can it remove waste efficiently and retain the things that it needs to? And if not, how do we help your body correct that imbalance and correct it as gently as we can? We are all surrounded in a world that ideally we wouldn't be exposed to things we don't want to. And we want to try to make our environment as nice and clean as possible, but that is impossible. We can't do it. You have to go out in the world. You got to drive a car. You got to be exposed to plastics. You are exposed to radiation. You have to be exposed to toxic chemicals. We just can't get around it. And when nothing else fails, what we do want to have is a body that can eliminate those toxins efficiently. And we have powerful systems in our body, our liver, our kidneys, even our skin, that can pull toxins out of us when we need to. And so when we're doing the functional medicine approach, sometimes this detox system, that's one that we want it to work well, absolutely. But sometimes we want it to work even better than well, especially if we have a biological imbalance around it. And then the last of these, and getting to be one of my favorite topics, that's a cell. And what that's like a human cell, and it's showing us something called the mitochondria. I translated energy. We look at energy, but for the patient as well, it's your energy. How is your energy? What is your energy? Do you have enough energy? So it turns out mitochondrial health affects some of the most important functions in our body. Our heart muscle has to have a lot of mitochondria that can generate a lot of energy and power. Our brain and our nervous system uses a lot of energy. I tell my patients all the time that if you're tired, if you've been at work and you're tired at the end of the day, even if your work was all sitting at a desk and looking at a computer, your brain by itself burned over 500 calories that day because your brain generated enough electricity to run several appliances. So when we start thinking about the amount of energy we need to produce and process, that's huge. So looking at mitochondrial health and how we can support that is a really powerful tool. And there's times that we need to go higher than normal. And then there's times we need to figure out if the energy needs to be supported by detoxing, if we need to support the energy by healing the gut and the microbiome, if we need to support that energy by helping some hormones be a little higher than they were before. So I know that's kind of confusing, but when you're in it, it all makes sense. But that's our approach in the functional medicine approach. I wanted to plug a little bit of information about chronic inflammation, which is a topic on social media I've been covering quite a bit. And these symptoms that you see here, pain, joint pain, eye redness, fatigue, I mean, you can see it's a lot of symptoms. These all, for any point, any one of us at any point in time, could be a sign of chronic inflammation. So, of course, I'm in Oklahoma. We have lots of allergies. And unfortunately, for a lot of us, what that could mean is that at any point in time, we're actually becoming chronically inflamed. Now it could be minor symptoms. It could be something more serious like unwanted weight changes, digestive issues, even high blood pressure could be signs of being chronically inflamed. Even without knowing your particular situation, there are 10 things all of us can do to help with our inflammation level and to be aware of. It really doesn't hurt. And I'll send you a copy of these slides. So don't feel the need to well, take a snapshot actually of your phone if you want to do a screenshot or take a picture. But these 10 tips you'll also get in your email. So starting your day with water is always good. If you add some turmeric to it, even better. Flaxseed are a great addition to your breakfast. Ground flax seeds go really good on cereals or oatmeal, or if you do smoothies. And one of the things you're going to get is a thank you for me, because I do appreciate having your time, is I'm going to be sending you a really cool recipe book that includes a bunch of I think it has like over 100 smoothie recipes. It's one that I reference. I've looked at it so much, I'm sort of forgetting, but it's got some really cool smoothie recipes. You could have a copy of it on your phone, use it to update your shopping list before you go shopping. So you'll get a copy of that when we're done. I'll be sending it by email. Cold therapy is it's gotten super fancy, and you'll see like billionaires having all these like cryogenic chambers that you go and you freeze your muscles in, but you can actually just take a cold shower, and that's cryotherapy. You don't have to buy a $5,000 cryo bit. I mean, if you want to, that's cool, but you can actually do that with just standing in a cold shower. I think the time is like actually if you can do it for 3 minutes, and it actually does a thing with your cells where your cells will start to reverse inflammation. Um, I am going to be sending you a copy of a 3-day anti-inflammatory diet. So inflammation affects all of us. And at any point in time, eating foods that support a normal operating immune system is a good thing. So I'm actually going to be emailing you a copy of that. Standing whenever you can, getting some movement. Dry brushing is using a dry brush and doing swirls over your skin, because it actually encourages those lymphatics that we talked about to drain themselves. Deep stretching, green tea, one of my favorites. I'm constantly telling my patients, a cup of green tea a day is usually a good thing. And then trying to get plenty of good sleep. Chronic inflammation is at the root of what's going to take most people to the doctor's office and what's going to take most people to a specialist. Heart disease, diabetes, autoimmune disease, Cancer really is a source of chronic, or comes from chronic inflammation and diseases of the brain, memory issues, Alzheimer's. A lot of people just don't realize that Alzheimer's, which right now there's drugs being developed, but I noticed that in the marketing of those drugs, they are completely overlooking that Alzheimer's is actually a disease of inflammation. You can improve the brain health by adopting some of these strategies. Even Parkinson's disease. So it's again looking at a different way, and the way we're taught in conventional medicine is that you can't do anything about these conditions, and that's actually not true. You actually can do something about them. So I'm Dr. Charlyce, and again, if you may have found me by Google search, by searching the IFM database, my practice is membership based, and the reason why is because we want to have that individualized approach. You get my full support when you interact with my practice. It's with me. And then you have access to powerful healing technology, including journaling and other things that will work along with your smartphone or smartwatch that really can take your care to the next level. With my memberships, it comes in a package. My annual membership includes a monthly consultation with me, unlimited support in between your consultations, is whether it's text, email, phone call. If we need to manage medications, most of my patients that find me are on the path of wanting to reduce their medication burden. And because I am licensed in, I believe, 13 or 14 states, and in the state of Oklahoma, I can assist in the managing of those. I don't do narcotics. Nature of this kind of practice is we can't do that or control substances. And then the biggest thing is you get the guidance and the tapering. And I'm very happy to work with your specialist or with your primary care doctor. I was a primary care doctor for 20 years, so I'm more than happy to consult and interact with them. And then I have a holistic annual membership, which is all the benefits of that previous membership that we discussed, plus the advanced testing that would be included in the monthly fee. When you start on the functional medicine journey, you need to gather data, and that's done with lab tests. It's done with quantifying your symptoms. It's done with our consultations. But the lab tests can actually be significantly pricey because where we are right now, unfortunately, insurance doesn't cover a lot of those. So with this holistic annual membership, you do pay more for this every month, but as part of your fee, that when it's time to do these testing, you don't have to pay any additional cost. After our consults, when we decide it's time, if we want to see where your digestive health is, if we need to do your allergy testing, we're able to address all of that when it's time, and there's no additional fee to you. This panel typically will cost up to $2,500 if you bought it all outright by yourself. So, and again, you'll get a copy of this slides, but even after our talk today, and where you are, because the basic fact is most people reach out to me aren't ready to quite make this step yet. And that's completely understandable because this is a big step. It's a huge part of your journey. However, you do have access to my dispensary with full scripts, which is an absolutely fantastic, high quality, only the best and safest supplements do they provide. So I have a store there. And if you sign up with that store, you save 20% on the supplements. If you're buying them in Whole Foods or Sprouts or anywhere else, you can save 20% by buying them through Full Scripts. They do come by the mail, but they're really good on their shipping. They're fast. And orders that are over $50, which if you take more than 1 or 2 supplements, probably you're paying more than $50, you'll get free shipping. So you'll get access to my health and wellness protocol, which is basically what I recommend for everyone to take to stay healthy. It's a good complement of probiotic, of vitamin. They're safe for everyone to take. They're a good way to get started. But also you can set up your account because Full Scripts has great patient resources. Absolutely fantastic. And then also you will have access to my store at Designs for Health, which is one of the premier supplement companies in the country. They produce their supplements here in the United States. Typically, they don't give access just to the public, but I do have a store with them, and with them for the summer in my store, I've highlighted some of the supplements that are great for summer travel. So I have included in there a multivitamin combo in which your omega-3, your vitamins, and your minerals are all pre-packaged. And so if you're going to be traveling for the summer, you can snap off 7, 10 of the packages, carry them with you. It's really cool. I recently took a trip for a conference and I carried those. It was so convenient. I also included some supplements that come in the form of like nutrition bars that actually travel really great. One that helps keep your magnesium levels up. So if you get like leg cramps when you fly, this bar is great, just the right amount of magnesium to prevent that. And if you use that code, you'll get to save a little bit extra on those supplements. And then I always put a plug because I'm trying to stay in contact with new folks, let you know there's multiple ways for us to interact. And there's going to be a free event next week that is more in the realm of energy medicine and sound healing. And I'll include some info in your handouts on that. That's open for everyone to attend, especially if you've been wondering about energy medicine, which I also practice. So that brings us to the end, and I'm going to go ahead and stop my screen share. But like I said, you'll have access to all of this. But we've got a little time for any questions, if anyone has any. So what we'll do is I am going to send you a copy of the slides. All my info, you'll have my contact info. So if you do have questions after this, I try to encourage you, email me, text me, either one is fine. Since we're coming up on one, I'll go ahead and conclude unless you have any questions for me.